Good afternoon. How's everybody doing? Good. Good. This whole month's topic is infectious disease. We're gonna go over the lecture here. Got about half hour, 45 minutes of that, and then in the interest of breaking things up and giving you guys a little more something to do than to listen to me talk, we're gonna break out into groups. We're gonna do a little tabletop activity. Okay. So, and then we'll break into our breakout sessions. The groups I put you in for the activity will be the same groups that you'll be in for your breakout sessions. This month over here at Station 1, we have IM Med Administration and the RAM cannula. Lab Room 2, we have some hands-on training with the ventilator. Lab 3 and Lab 4 are both infectious disease-related scenarios. So we'll get to going on that, and we'll get out of here. A couple of things from the EMS Bureau, just to be clear. The RAM cannulas are on the medic units and are available to use, okay? And they can be restocked at the annex. Also, the ventilator, you are able to use it for BiPAP. I guess there was some confusion if you could use it for BiPAP or not. Just not using it for CPAP right now, BiPAP and cardiac arrest. So, any questions on any of that stuff? Okay, so getting into infectious disease, we're going to review different diseases and their origins. We're going to talk about transmissions and how you can be safe and how it's all relative to us. So why is it important to us? We're in it. We're in it every day. You don't know what you're walking into when you're walking into somebody's house. You don't know what kind of exposure risk is out there. You can quite often maybe smell that something's going on, but you can't see if something's going on, right? You can't see if you're being exposed. So our role with the public health, when there's a problem and there's not always an answer to it, it usually gets dumped on fire departments, right? And EMS departments. Quite often, like with public health stuff, we're available, 24-hour service, ALS response, things like that. It's easy to just call the fire department. Chain of infection, again, we've got 4 different types of agents, okay? Bacteria, probably one of the worst bacteria infections, but not as often seen. Viruses, a lot more common, but doesn't take quite as much to get infected, right? And fungus and parasites, these are all kind of variable, right? They're location specific, they're food or type specific. It's all relative with those two, right? We typically live, though, in the virus and bacterial world. So, as far as a dose goes, for viruses, you only need a few organisms to start an infection, right? Somewhere between 10 and 100 organisms will cause a viral infection. With bacteria, it's more like, over 100,000, right? So, way more it takes to cause the bacterial infection, but it also doesn't happen as often, right? So, and that's also why it's worse as well, because there's so much more of it. So, but our modes of entry, we'll get into that in just a second, and then our host, right? It all depends on our host as well. Some could have a very strong immune system, others may not. I'm very fortunate. I have the immune system of a tank and a stomach of scrap iron. So, but if there was a poster child for man flu, it would be me. Because when I do get sick, I'm down and I hate it and I don't like being sick. So, but then you have others who may have like diabetes or autoimmune disorders who are more susceptible to getting sick and illness, and it could be, multiplied times worse for them. So, bless you. Our modes of transmission: contact, direct contact, and indirect contact. Contact is skin to skin, touch to touch, right? Indirect is infected host touches a table or a chair or a bottle of water, and then the next person picks it up and touches it. So, droplet, inhaling particles, fluid particles that are in the air from like a cough or a sneeze. Keep your distance, try to avoid getting infected. And airborne. Inhalation of the airborne particles, you want to keep your distance as well. at least 6 feet, 3 to 6 feet. But you can't, again, stuff that you can't see, right? So, vector-borne, this is usually done through animal or insects. And then blood-borne, which is some form of needle stick, right? Like, for example, right? You know, all the fluids should be considered infectious. I call it funk. Whether it's virus, bacterial, or otherwise, it's all funk to me. It's disgusting, it's nasty, and we should try to avoid it. Soap and water, best form of defense before and after every patient. Hand sanitizer, you guys got hand sanitizer on the ambulances for yourselves? No? Yeah. Proper PPE, again, gloves, every patient. Most are non-latex nowadays due to allergies. Eye protection for our intubations and stuff like that. You guys use eyeglasses for every intubation? Gowns for highly contaminated scenes. What would you use a gown? What kind of situation would you guys put a gown on?
Shit.
What's that? Shit? Yeah. Feces? Yeah. Blood, right? COVID, maybe, right? Major trauma with major bleeding, right? Or childbirth or anything where there's a lot of funk, right? So, with your masks and respirators, droplet precautions, could probably get away with a decent surgical mask. Airborne, more in the N95 respirator. Did you guys have like the PAPR? I call them a PAPR in the hospital. Like it looks like an ET helmet and face shield, and no? Not on the rigs would you have them, so like if you had another COVID-19, they could be deployed. Okay, cool. So bloodborne pathogens, again, we've got like our HIV, which is viral, which eventually leads to AIDS, which is a long-term autoimmune. Basically, at that point, your cells aren't able to fight back on the infection. So, Hep B and Hep C, these attack your liver. Very painful, long-term, no cures. Your response protocol, your exposure response protocol. So you have some form of exposure in the field. What's your protocol? What are you guys doing? Respiratory infections, influenza, many strands of the influenza flu. Highly contagious, pretty common. It's viral in nature. COVID-19, anybody ever hear that? That was a new one, I had to research it. Viral in nature, again, sweep the world, shook up everybody's lives for a few years. TB, again, two types. They've got like inactive and active. The inactive they call latent. Not a whole lot going on, not a lot of symptoms. It's bacterial in nature, could go on for a long time. Inactive can turn into active, which is extremely dangerous. Patients develop serious long-term coughing issues, coughing up blood, weight loss, night sweats, things like that. RSV, viral infection in nature. These are typically like severe cold symptoms. Usually attacks in the littles, right? Like the little kids. The worst cases up to 6 months, and then up to about 6 years. Adults do test positive occasionally for RSV, but for them it's like a flu. Right? So, signs and symptoms of influenza, all the usual suspects, right? High fever, body aches, fatigue, pain, cough. COVID-19, all very similar. However, your symptoms could be mild to wild. I had it, and I had like the most severe head cold I've ever had in my life. And then I couldn't taste or smell anything, which was bad. My wife had to put me on suicide watch because I like to eat. And when I lost my sense of taste, it was bad. So, as soon as I got it back, though, went to Alexis Road, got me a fries from McDonald's, a Whopper from Burger King, and nuggets from Wendy's, hit up all the favorites, right? So, tuberculosis, again, chronic cough, weight loss, night sweats. So, RSV, common with the kids, flaring of the nostrils, something note of. sepsis. What's your guys' sepsis protocol? Notify the hospital. Are the hospitals pretty receptive to it? Well, I only ask because in the other sessions I've asked, some say, yeah, sure, but like in the very first one, I said, what's your protocol? They go, we call the hospital, and then they act like they don't care. so, um, yeah. High fever, altered mental status, hypotension. I understand you guys have a form in ESO for sepsis you could fill out. Gastrointestinal, the norovirus, stomach bug, common flu. When it hits one person in the house, it tends to hit everybody, right? So sometimes starts with the kids, they get it at daycare, and then it spreads like wildfire. Salmonella, bacterial in nature, nausea, vomiting, diarrhea symptoms, beats up on the intestinal tract. C. diff, again, bacterial in nature. Terrible diarrhea symptoms, has a terrible, disgusting smell that goes along with it. You send a probies in for those ones, right? Again, norovirus, all the usual suspects. NVD, abdominal pain, severe vomiting. Salmonella, the thing with salmonella is it's hard to detect when and where you got it because there's such a long period where symptoms can develop between 6 hours and 6 days, right? So if I got a tough immune system, it might take a little bit longer. If I'm a little bit more susceptible to things, it might not take as long. So, and C. diff is pretty similar, 4 to 10 days. So, neurological infections. So, what's the big difference between meningitis and encephalitis? Some key things. One affects the brain specifically, and one affects the brain and the spinal cord. Meningitis affects the brain and the spinal cord. Two types, we have viral and bacterial. Viral, a little bit more common, not nearly as severe, but bacterial can be pretty dangerous, severe sudden onset of symptoms. Blotchy skin, stiff neck, high fevers. The encephalitis, more viral in nature, comes from like a West Nile or ticks, things like that, and can cause seizures, right? So that's the symptom takeaway. So, some more infectious diseases. Ebola, again, it causes hemorrhagic fever, very painful, very disgusting. Muscle pains. Mpox, this is in the same family as smallpox, contagious rash, fever, all the usual stuff. Okay, attacks on the lymph nodes. Bioterrorism, would you guys say bioterrorism is handled through special ops? Most things? Yeah. Just because I'm curious and I'm still trying to learn all your guys' different bureaus, what all does special ops handle? Okay. Sure. So from the EMS Bureau, should an exposure occur, they want you to contact your immediate supervisor, do all your exposure reporting, okay? Move it on up to infection control officer and apparently health and wellness officer as well. At some point it gets to them. And again, it's standard stuff. You get exposed, you clean the area really well with soap and water, or if it's in your eyes, flush your eyes for a healthy 10 minutes, right? Fill out all your infectious disease stuff. And try to get if it's significant enough, get seen at that particular ER where you're at. So, stay safe, protect yourselves, protect your partner.